Now, moving on to segment 4, which is gastrologist advanced diagnostic test. They might perform these tests to get more detailed perspective or picture of your gastrointestinal health. We'll talk about three, and obviously, following the series that we have been talking from previous segments as well. Number 16 is comprehensive stool cultures. Number 17 is SIBO, small intestinal bacterial growth, and 18, celiac disease biopsy. Now, first, let's talk about comprehensive stool cultures. So, comprehensive stool cultures are recommended if you have persistent gastrointestinal symptoms like diarrhea or constipation or abdominal pain that do not respond to initial treatments. And if you have traveled to the areas with known gastrointestinal pathogens. The purpose of this test is to detect pathogens not identified in standard test and is useful for diagnosing infections causing diarrhea, constipation, and abdominal pain. The standard stool test may miss certain pathogens that cause gastrointestinal symptoms. Comprehensive stool cultures help identify broad range of bacteria, virus, and parasites that could be causing issues such as chronic diarrhea or abdominal pain. So, comprehensive stool cultures target a wide variety of pathogens, including bacteria, Clostridium difficile is also known as C. difficile, Salmonella, Shigella, Campylobacter, Escherichia coli, common known is E. coli, viruses such as rotavirus or norovirus, and parasites such as Giardia, Entamoeba histolytica, Cryptosporidium. And these tests are done through through a stool sample. You will be provided with a sterile container to collect a stool sample at home, and it is then sent to laboratory to get the test. In the laboratory, where it is cultured to identify any pathogenic microorganisms. So additional tests such as PCR, polymerase chain reaction, may be used to detect specific viruses and parasites. Obviously, the best case scenario we are looking for is no pathogenic microorganism detected, while you it is a test which has a minimum discomfort because it's just about taking a stool sample and setting that to laboratory. It's very non-invasive, and obviously you may require follow-up test with specific pathogen PCR test if the stool culture tests are inconclusive. And this is how gastroenterologists can decide whether bacteria, virus, or pathogens are causing your chronic diarrhea, abdominal pain, or chronic constipation. And next, we have the SIBO breath test. SIBO meaning small intestinal bacterial overgrowth breath test. So this test, the SIBO breath test, is recommended if you have symptoms of bloating, diarrhea, and nutrient malabsorption that suggest bacterial overgrowth in the small intestine. So SIBO occurs when excessive bacteria grow in the small intestines. So this helps confirm the presence of bacterial overgrowth. The SIBO test measures the levels of two main gases in our breath, one hydrogen and two methane. So elevated levels of these gases indicate bacterial overgrowth in the small intestine. Lactulose or glucose are sugars that are not normally absorbed in the small intestine. If bacteria are overgrown, they ferment these sugars, producing hydrogen and methane. Let me repeat, lactulose or glucose are the sugars that are not normally absorbed in the small intestine. If the bacteria are overgrown, they ferment on these sugars, lactulose or glucose, and then produce hydrogen and methane. So elevated levels of hydrogen typically indicate small intestinal bacterial overgrowth, and also elevated levels of methane can suggest colonic bacterial overgrowth or archaea overgrowth, which may cause constipation rather than diarrhea. So methane is the culprit in the colonic bacterial overgrowth. For this test, you will need to follow a specific diet for 24 hours before test and fast for 12 hours before the test. Basically, you'll be drinking a sugar solution, usually lactulose or glucose, then provide breath samples at regular intervals over a few hours. Then the breath samples are analyzed for hydrogen and methane levels. Elevated levels, as I mentioned earlier, indicate bacterial fermentation of the sugar solution in the small intestine. And the best case scenario we are looking for is a normal results with low levels of hydrogen and methane. And this can have mild discomfort because it's about 12 hours of fasting and drinking a sugar solution. If you ask me, I fast for 16 hours, not a problem at all. But again, some people may may not be used to fasting, so for them it will be mild discomfort. And these days there are newer and non-invasive breath tests for SIBO being researched, though endoscopy with bioscopy remains the gold standard for more detailed diagnosis. But again, breath tests can be done to diagnose whether your small intestinal bacterial growth is causing your gastrointestinal intestinal health. So if you have these kind of symptoms, please consult with doctor, or you are not getting these tests done, you can ask for it. As I mentioned ago, always advocate for test. And you know you know your health better than anybody else. If you have been keeping a detailed record of your symptoms, what you eat, and then analyze and correlate between what you eat, what you do, and your gastrointestinal symptoms, you'll be able to have a very general direction about what's causing it. And based on that particular general direction, you can discuss with your healthcare provider. And another one which we want to talk about is number 18, celiac disease biopsy. So this is when it is recommended if you have a positive serologic test for celiac disease, such as TTGIGA, which you talk about in the biomarkers as well. So it is a blood test, and if the marker is up, then it's indication for celiac disease, which is autoimmune condition reacting to the gluten. And the symptoms you may have is chronic diarrhea, abdominal pain, and nutrient deficiencies that can suggest celiac disease or other inflammatory conditions. So this celiac disease biopsy is taken during endoscopy to diagnose conditions like not only celiac disease, but also other such as eosinophilic gastroenteritis and microscopic colitis. Obviously, a biopsy is a gold standard for diagnosing celiac disease, which is an autoimmune condition triggered by gluten. And it can also help diagnose other conditions we mentioned earlier about eosinophilic gastroenteritis and microscopic colitis. Again, it's crucial to be on a gluten containing diet before the test for accurate results, as a gluten free diet can normalize the small intestinal lining, leading to false negatives. And again, keeping a detailed record of containing of gluten containing food and also your gastrointestinal symptom, and mapping what you eat with what your symptoms can also give you a general indication that gluten may be causing your chronic constipation or digestive distress. And these blood tests for celiac disease and biopsy are to confirm whether these celiac disease is the root cause of your chronic constipation or gastrointestinal disorder.